In medicine, knowledge changes fast. New research, new treatments, new standards. But here's the real question. How do you take that knowledge and turn it into education that actually changes how clinicians practice? Because the gap between what we know and what is done at the bedside is where patient outcomes are won or lost. Hi, I'm Rick Davis, President and CEO of Arbor Scientia. For more than 30 years, I've led medical education across the globe, including my time as Senior Vice President at the Neuroscience Education Institute. I've built programs, written books, and coached leaders, all with one goal: education that transforms clinical outcomes. Today, I want to share 3 principles for building medical education programs that genuinely move the needle. Point 1. Start with the outcome, not the content. Most programs begin by asking, what should we teach? The better question is, what do we want clinicians to do differently? When you design backward from a measurable clinical behavior, every piece of content earns its place. You stop teaching for coverage and start teaching for change. That single shift turns a lecture into a lever. Point 2, make the science stick. Clinicians are busy and information fades fast. The programs that last are built on how the brain actually learns through repetition, real cases, and emotional relevance. Connect the science to a patient's story, reinforce it across multiple touch points, and you move knowledge from short-term memory into daily practice. Point 3, measure what matters. Attendance and satisfaction scores feel good, but they don't tell you if anything changed. Build measurement into the design from day one. Track clinical decisions, prescribing patterns, and patient results. When you can prove a program changed practice, you've proven it changed lives. So remember, design for outcomes, teach the way the brain learns, and measure real change. Do that, and your education becomes more than information. It becomes transformation. Start with one program, one outcome, and build from there. You, the clinicians you reach, and the patients they serve will reap the benefits of your efforts.